Hospital and the complex in Tabeni and St. Augustine's and the other related hospitals, and leaders from various hospitals, Nkosi Albert Luthuli, King Edward Hospital, and other hospitals nearby. Thank you very much for being with us this evening. Today has been a very emotional day as we reflect on the past year living with coronavirus. I want to thank you for inviting us to witness this occasion. It's not often that awards are conferred to professionals by ordinary people, and yet these inaugural awards have captured the wonderful spirit of appreciation that so many South Africans from all walks of life have for our healthcare workers. Thank you for giving a voice to the ordinary people so that our professionals can be recognized with the dignity and humility that reflects the work ethic for which they are being recognized today. The World Health Organization designated 2020 as the International Year of the Nurse and Midwife to celebrate the great work that the nurses and midwives are doing, highlight the challenging conditions that they often face, and advocate for increased investment in the nursing profession. The year 2020 was significant for WHO by recognizing the critical role that nursing and midwifery played in strengthening universal health coverage. The plan for 2020 was to improve the public's understanding of the contributions of nurses and midwives that they make in the society that they live in. The global epidemic called for a different approach to celebrating nurses, the real leaders of the world to health. For most of our communities, a nurse is first to be seen at the time of birth, a heartbeat of the health system throughout the lifespan, providing preventative, curative, and rehabilitative care, and often the last to help close the eyes at the time of the end of life. Since South Africa reported the first COVID-19 case on this very day, we have witnessed the steadfastness and the resilience of this cadre of healthcare workers through their great contribution in the response to the pandemic. Although this was achieved under very challenging conditions with our own health system, nurses soldiered on persistently and remained at the forefront even where their own lives were at risk. We also acknowledge the fact that all the other cadres of healthcare workers rose to the occasion in the fight against COVID-19. We have emerged as world leaders in health emergency because of the expertise, courage, and the stamina on that field. The Angel Wings initiative resonates with the resolution adopted on the 73rd World Health Assembly, where all member states unanimously designated 2021 as the International Year of Health and Care Workers, in appreciation and of gratitude towards the healthcare workers for their unwavering dedication in the fight against COVID-19 pandemic. The WHO has therefore launched a year-long campaign under the theme Protect, Invest Together. The objective of that campaign are to ensure that the world healthcare workers are prioritized for the COVID-19 vaccine in the first 100 days of 2021. To recognize and commemorate all healthcare workers who have lost their lives during the pandemic, and to mobilize commitments from member states, international financing solutions, bilateral and philanthropic partners to protect and invest in healthcare, in health and care workers to accelerate the attainment of the SDGs and COVID-19 recovery, and to bring together communities, influencers, political and social support, solidarity, advocacy, and care for healthcare workers. The campaign highlights the urgent need to invest in healthcare workers, shared dividends in health jobs, economic opportunity, and equity. This means appropriate protection and improved conditions of work, as well as additional investment in healthcare workers, education, and employment. It also means a shared vision for investing in people as the foundation of all. We therefore welcome and appreciate the initiative by SAFLEC to honor our healthcare workers as soldiers that go over and beyond the battlefield by awarding them the Angel Wings, a solemn distinction and means of symbolizing the immense gratitude we have for the great sacrifices whilst in the line of duty. We have to say at this point, we really appreciate this initiative, Ms. Singh, and it gets born out of the spirit of gratitude of a lady over 70-year-old, Ms. Meera Singh. Mrs. Singh walked into this hospital and saw her family members for the last time. And as they were walking back home, I know for a fact they actually doubted whether they'll ever see her alive. And she also would have understood that she was unlikely to make it alive back to her house. In the process, there is this problem of having to get into the hospital. You don't know anybody. You are lying there alone when you're going through the pain that you are going through. And what goes on in your mind is, am I going to make it? And this, for me, has been the one issue that's always a challenge. And I can tell you, this question, whether you'll make it or not, comes for everyone who's been tested positive. And it comes because you know that being positive is the beginning, but the end of the journey is unknown. I can recall this and relate to it because when I got the infection, my wife was more unwell, and therefore she got admitted. At night, I had to call my son and say, listen, I've booked a bed. If I feel there's any problem at night, wake up and come and take me. And I had the pulse oximeter with me, and I had to go through this to say, after every so many 2-3 hours, I must check, because that was the only indication I would ever get. Now, with my age and comorbidities and everything, I was a perfect candidate to be taken in the hospital. And to make it more, the doctors did call and say, are you fine? Do you want to come and be admitted? Well, they gave me the option. But I'm saying, knowing all I know about medicine, the thought came, what will happen? And in this case, this is the part that's really set in me and gave me grief throughout the year, because you walk into the hospital, everything else, you literally lost control. You can never tell what's going to happen once you go into the hospital. Then one doctor wrote a letter, and I can't recall what his name was, but it was a long article. And he spoke about how they're working so hard, how this thing has just changed the way they deal with emergencies, how they deal with the treatment of patients, and how this has become an unpredictable kind of disease. He went on to talk about how every patient goes in and they have to look at the patient's eye and greet him in the morning and ask them how they are they feeling better or not, and so on, and figure out what to do to help them. And sometimes you feel the patient, all you need to do is to hold the patient by hand or put a hand on the shoulder, and then just say, you'll be fine. And he says, and those patients have not seen their families. But don't say they are alone, because we are there. And that was very touching. He says, when we are there, we are the family that they can't reach. We are the friend that they have left behind. We are the source of support and psychological counseling that they can never get anywhere else. We are there. And I want to say to the nurses, these particular nurses, that there are many nurses, there are many doctors, there are many health workers who go beyond the call of duty. Unfortunately, the soft, warm, caring actions that they take don't make it for the headlines because they are not as bad as someone who will say, they ill-treated me. That is what makes headlines. But the silent majority of the healthcare workers are out there caring, supporting, comforting, and helping each one person to stand up and face another day and fight. Those are the heroes that we are honoring today. And I want to say thank you to Mrs. Singh, because she's actually just ignited what is existing amongst all of us to say there has to be a way of how we show the gratitude of South Africa to all the nurses, to all the doctors, to all the healthcare workers, to whom people, surrender their lives, and they hope that at the end of it, they will be able to recover from the challenges that they face. And because of that, the biggest one young doctor, who's a nephew, sent me a note when I was sick, and he said to me, well, be strong, just remember that more important than the physical symptoms that you are having, the real issue is about the spiritual battle. Will you remain strong enough every day for the duration of the symptoms to enable that whoever is helping you to be able to give you the support you need and to enable that treatment that you get to work in your body? The biggest problem is psychosocial trauma. And that is the one that is not visible. And so it's a trauma that's a problem because one person has to go through this alone. You can't share it with your family, you can't share it with your loved one, you can't share it with anyone. Fortunately, there are nurses and doctors who are there. We've received messages from friends who are in hospital when they feel that everything is difficult. Sometimes some of them don't come back. But you can tell, everyone can feel that actually their life is going down. And this is what you have to face through as healthcare workers every day when people have lost all hope and they feel that nothing else is going to help them. And in this case, I like the spirit. Mrs. Singh, we wake up every day to come and help you to be strong so that you can actually walk out of this place alive. Now join the team. What we have never quite said all the time is that we are all part of that team that we need to be able to continue the fight. And so I want to say to the health workers in South Africa that today, 1 year on, we're saluting them. We want to say, you have done us proud. And from that point of view, thank you. From that point of view, we know that without you, South Africa wouldn't be where we are. And therefore, we have started the whole program of saying the vaccines must come, and they have come. And today, last year on this day, we were saying patient. That was our first patient. And today, we're saying 100,000 health workers have been vaccinated. Although it's going to be starting a bit slower than we wanted, but we are really hoping to accelerate it come to end of April. We expect that we should be able to accelerate it to go to beyond the health workers to all those who are at risk. And from the point of view of what we need to do, we need to intensify the use of masks and distancing and delay as much as possible the next wave so that we can vaccinate as many people as possible. This wave can come quicker or later depending on how we behave. We were actually taken by a huge surprise by the last wave. It came quicker, it was more intense, and on top of that, it actually started getting a mutation. And this variant right now is actually almost 99% of the cases that were detected in February. This is how fast it has actually spread. It has undermined all the scientific rules of vaccine production, and really found a way that in some instances, actually the vaccines may not be as effective as what was originally expected. So from that point of view, if we slow down the wave, we'll actually reduce the risk of another variant coming up. And therefore, we want to say the vaccines that are coming here, our words